Hello everyone, I'm Jan Kiener, one of the PNMT instructors, and I wanted to tell you a little about the upper extremity seminars. It's really fun for me to teach this class because throughout the weekend I see little light bulbs going on above therapists' head as they think, oh, this person could really use that, or I'll have to try this on that client. It just reminds me of how many people we know can really use this work. I've been a massage therapist for 20 years, and the tools from this seminar have really allowed me to work with people like golfers and musicians, surgeons, people whose talents and skills I admire so much. And these tools help me keep them doing what they do so well. Throughout the seminar, we spend a lot of time looking really in depth at the muscles of the shoulder and the arm and the hand. And we rule out, there are some tests that can rule out more serious things like rotator cuff tears or intrajoint pathology. We look at conditions like carpal tunnel syndrome, impingement syndrome, frozen shoulder, trigger thumb. We also look at the shoulder and the arm and just the interplay of the muscles. For instance, we measure the range of motion of abduction of the arm, which should be about 170 degrees. In order for that to take place, really two things have to happen. The head of the humerus has to rotate within the glenoid cavity of the scapula. But that movement alone only gets us to about 60 degrees. Because at about 60 degrees, it gets stopped by the acromion of the scapula. So 60 degrees, if this is 90, this would be about 60. It gets us here. To get any further past there, then the whole scapula has to do an upward rotation. And then there's a whole different list of muscles that do that upward rotation of the scapula. And that allows us to continue on to 170 degrees. So understanding that sort of thing and which muscles play the role of that movement, as well as kind of the shadow muscles, the muscles that do the opposite movement, helps us really get to the bottom of somebody's problems if they have pain or restriction in this kind of movement. As all PNMT seminars, there's just a wealth of information, a lot of layers. And because that's true, it works for a beginning therapist and also for a very experienced clinician. You can just sort of pick and choose how many layers you want to take on. For someone who's newer, this would be a chance to really become an expert at working on the individual muscles, as well as starting to understand the relationship of the muscles. For a more experienced clinician, it's a real chance to ramp up the skills and take the clinical skills to a new level. I think probably one of my favorite things that we do in the seminar is look at the nerves, the brachial plexus that serves the arm and the hand. I'm sure that one of the reasons why I enjoy that so much is because for so many years I was really so clueless. If someone would come in complaining about nerve symptoms in the arm and the hand, I really didn't know what to do for them. So in this seminar, we really learn the language of nerves, what they like, what they don't like, what they need. As well as physically, we spend time exactly tracing, especially 3 branches of the brachial plexus as it goes all the way out to the hands. Once we understand the language of the nerves, it's much less mystifying about what the symptoms are telling us, and then we have so many more tools to help get people out of trouble. So this is just a kind of a brief overview. It's just a lot of fun, and I hope to see you in the upper extremity class.